Chapter 12, Immune System Disorders. Immune disorders result due to the malfunction of the immune system. Immune disorders can lead to hypersensitivity. Hypersensitivities are inappropriate immune responses that harm us. Immune disorders can also lead to immunodeficiency. Immunodeficiencies are inadequate immune responses that fail to protect us. Hypersensitivity. Hypersensitivity is response to antigens or allergens leading to damage. The individual is sensitized by the allergen and an allergic response occurs after second exposure. So most people think that if they eat something for the very first time that they'll become allergic. No, you have been exposed to at least one time before, and upon that second exposure is when you're going to have an allergic response. There are 4 types of reactions. There's anaphylactic, cytotoxic, immune complex, and delayed cell mediated. All 4 types have a different time after exposure for clinical symptoms. The fastest one is type 1, which is anaphylactic, which is less than 30 minutes. Type 2 is cytotoxic, usually 5 to 12 hours. Type 3, immunocomplex, 3 to 8 hours. And delayed cell mediated is more than or equal to 1 day. Let's take a look at type 1 first. Type 1 anaphylactic hypersensitivity. Symptoms develop within 10 to 20 minutes, so less than 30 minutes to react. The responses can be local or systemic. Type 1 involves IgE antibodies. IgE attaches to mast and basophil cells, which we know have granules in them, and those granules are filled with mediators. So those granules will be mediators would be histamine, prostaglandins, and leukotrienes. And we've already learned what all 3 of those do back in chapter 9. IgE again attaches to the mast and basophil cells. The antigen binds to the 2 adjacent IgEs, and the mast cells and the basophil cells undergo degranulation, which are going to release the mediators. Possible responses, of course, would be increased permeability and dilation of capillaries, increased mucus secretion, smooth muscle contractions or wheezing, and a chemotactic response that signals neutrophils and eosinophils. So here it shows you your antibody bound to a antigen. So these are your IgE antibodies, and they're going to bind to your mast or your basophil cells using that Fc region, the stem region, and that's going to cause degranulation. And degranulation means that it's going to release the mediators, and one of those mediators is histamine, and we know that's going to cause increased permeability and dilation of blood vessels. Systemic anaphylaxis is basically anaphylactic shock, and it's usually shock from ingested or injected antigens. So you may have gotten an injection, an insect sting, or penicillin. Usually there's a dilation of blood vessels and a decrease in blood pressure, which may result in a circulatory collapse and death. So usually the best way to treat this is with epinephrine, and most people that have very severe allergies use something called an EpiPen. Localized anaphylaxis is associated with food or pollen. So usually with this, symptoms would be hay fever, asthma, and hives. In the upper respiratory, you may get sneezing, watery eyes, and itching. In the lower respiratory, you may get asthma. In the digestive tract, usually you get hives, and it may become systemic, and we see this with peanut and egg allergies. So what is one of the ways to prevent anaphylaxis? Well, one way is to do skin tests to determine what allergies a person has. So a small amount of allergens are placed on the patient's skin. So you see here that they put the person's arm out and they put allergens on this person's skin. If the person is allergic, mast cells are stimulated to produce small hive-like swellings called a wheal, where the allergen is applied. Although skin testing is accurate, it is uncomfortable for the patient and is sometimes life-threatening. So once you find out what you're allergic to, then the next best thing to do is to avoid it. Don't eat it at all. Don't become exposed to it at all. There's also what we call desensitization injections of the antigen, and this is what you hear about with allergy shots. Desensitization would involve injecting increasing amounts of antigen to cause the production of IgG, so that IgG antibodies will act as blocking antibodies. So the whole goal of the allergy shots is to call IgE last and let IgG come first. So you want IgG to come first and then IgE. You don't want IgE to come first, because if it does, then you're going to have your allergy reaction. Type 2 cytotoxic reactions occurs when the immune system mistakenly attacks some of our own cells as if they were invaders. So in this scenario, notice I have in quotation marks, the antigenic cell is lysed. Okay? And usually an antigen would be a foreign cell, or it could just be our self cells coated with drugs. In this scenario, IgG and IgM combine with an antigen, and then what happens is that you activate the complement system. And remember, one of the effects of the complement system is to cause cytolysis. This usually occurs 5 to 12 hours after second exposure. So we see this with ABO or Rh antigens or incompatible blood transfusions. So in this we see red blood cell lysis if you get the wrong blood type. So here we have to review the ABO blood group system. If someone is type A, that means that they have A antigens. If someone is type B, that means they have B antigens. If someone is type AB, that means they have both antigens, both A and B. If someone is O, that means that they have none of these antigens. So what antibodies would they have against them? Well, if I'm A, I definitely have anti-B antibodies. If I'm B, I have anti-A. If I'm AB, then I don't need any antibodies because I have both antigens. And if I'm O, I don't have any antigens at all, so I will have antibodies against both. Which one is more common? O. O is more common. Then comes A, then B, then AB. The Rh factor. The Rh factor is named for the rhesus monkey. 85% of the population has it. A person is classified as positive or negative for the Rh antigen. So now we see where we get the A positive or the A negative. Rh negative people make antibody for Rh after initial exposure. So this may be from a transfusion or from Rh positive baby across the placenta. There will be allergic response if exposed again. So Rh negative people will have to make antibodies against the Rh factor. Rh positive people do not make antibodies for Rh because they already have the Rh factor. Hemolytic disease of the newborn. A mother is pregnant with a first child and she's negative. Okay, let's just say she's A negative. But the father doesn't know what blood type he is, and neither does the mom. Okay, but there's a 50-50 chance that father may be positive or negative. In this scenario, the father is positive. So the baby either will be negative or positive. In this scenario, the baby is positive. So what the mother does is she doesn't have these Rh antigens. So she's going to make antibodies against that antigen. She gets pregnant a second time by that same father, and this baby again is positive. Now her antibodies are going to attack her baby and lyse those baby's red blood cells. So that's what they mean by the hemolytic disease of the newborn. So how do we prevent this? Well, mothers that are negative are given a RhoGAM shot. And that RhoGAM shot prevents moms from making antibodies against her baby. Drug-induced cytotoxic reactions. Quinine used to be used to treat malaria, and it actually binds to platelets. So it acts as a hapten. So remember when we talked about something that's incomplete antigen, when it gets together with a serum protein, then it's going to be a complete antigen. So once we have a complete antigen, IgG antibodies are produced. Those antibodies are going to bind with platelet and complement. The platelets are going to be destroyed. And remember, platelets are important in clotting, so that leads to hemorrhaging. And then what we end up seeing is purple spots, and this is called thrombocytopenic purpura. So you'll see here, platelet and the drug come together, form a complete antigen, and that's going to cause you to hemorrhage. Type 3 immunocomplex reactions. In type 3 reactions, it resembles type 2 hypersensitivity in that the antibodies react with the components of a person's own body. So you have antibodies against soluble antigens circulating in the blood. The IgG antibodies and antigens are going to form immunocomplexes that lodge in basement membranes. So it involves IgG, and the response occurs in 3 to 8 hours. It requires a certain ratio of antigen to antibody. When antibodies in excess, then that causes complement activation, which causes attraction of phagocytosis, also known as opsonization, and that attracts the neutrophils. When the complex gets trapped in the basement membrane, the neutrophils begin to cause vessel damage. So instead of just taking out the antigen, it's also taking out your basement membrane. And we see this in glomerulonephritis. Okay? And this is in the kidneys, in the glomerulus. And you can see here, we have more antibodies to antigen. And they're calling the neutrophils, and the neutrophils are coming and they're releasing these enzymes. And of course, instead of taking out the antigen alone, it's also taking out your basement membrane. Type 4 cell-mediated reactions are delayed type hypersensitivities due to T cells, and the antigens are usually bound to tissue cells first. Upon first exposure, you have phagocytosis by macrophage that then presents it to the T cell receptor, and then the T cell proliferates. Upon second exposure, your memory cells are going to remember, and it's going to activate the T cells, which release cytokines, and those cytokines are going to attract macrophages, and inflammation occurs. We see this in poison ivy, in latex, contact dermatitis, and with the TB test. So this is an example of a delayed type hypersensitivity. This shows you the poison ivy, and it works almost the same with the hapten, because you're binding with a skin protein, and then the pantocatocol from the poison ivy come together and form a complete antigen, and hence you get dermatitis, which is the reaction to poison ivy. Autoimmune disease is a loss of cell tolerance. Normally, T cells pass through the thymus, and those specific for self-antigens are deleted. We've seen this in clonal deletion. So clonal deletion during fetal development ensures self-tolerance. However, autoimmunity is the loss of cell tolerance. There are 3 types: cytotoxic, immune complex, and cell-mediated. In the cytotoxic autoimmune responses, you have Graves' disease. In this one, the thyroid gland is overstimulated by antibodies that bind to thyroid gland cells. So in this situation, the antibodies are reacting with the cell surface antigens on the thyroid gland. Basically, when you have Graves' disease shows an enlarged thyroid gland, overproduction of the thyroid hormone, and bulging eyes and goiter. So it's an example of an altered cell function. the thyroid gland becomes hyperactive. And one Olympic star had this, and her name was Gail Devers. Rheumatoid arthritis and immune complex autoimmune reactions. We see immune complexes of IgM, IgG, and complement deposit into tissues. So IgM is bound to the Fc region of IgG, rheumatoid factor, and it gets deposited into the joints. From there we see severe inflammation from the immune complex in the joints. So if you remember what we talked about with the glomerulonephritis, where they formed a complex and then they started secreting all of these chemicals, enzymes. Here's your joint capsule. Everything looks beautiful and dandy, but then when you have these antibodies binding here, they're eating away at your capsule. Cell-mediated autoimmune reactions is mediated by T cells. And we see this with diabetes mellitus. The T cells help to destroy the islets of Langerhans. So the islet cells produce insulin. Without insulin, a diabetic cannot metabolize sugar, and sugar accumulates in the blood. This causes organ damage over long term. Type 1 diabetics must take insulin injections, and it's often difficult to determine how much insulin to take under various circumstances. Here ends Part A of Chapter 12.